Thank you, Mr. Chair. I just wanted to piggyback off of Dr. Murphy's comments, and he's no longer here, so you can be very forthright. But just if you could each go down the row and just respond to what he said about, is this system failing you, and should we be pursuing another direction? Just curious.
The one comment I would like to make is that, and I will answer your question, the Joint Health Information Exchange has been one of the successful parts of this project that we've delivered. VA and DoD are now exchanging data on 3 health information exchanges. Data is exchanged with more than 90% of US hospitals. And so I actually rarely walk to the fax machine anymore. I can find the record from community providers. And so I think, I just wanted to make that point. Second, as I mentioned earlier on, we are committed to moving forward. We have invested a significant amount in the success of this project. I think we're beginning to see improvements as a result of the reset. It's slow and incremental, and we expect it, and frankly, it must accelerate. But I still believe that we should proceed forward.
Okay, thank you.
The interoperability of healthcare systems between our medical center, other VA medical centers, other agencies, and private sector is extremely important. As we heard, the ability to, if one of my patients is being seen in Spokane and then needs to go to a private hospital in Spokane and then is going to come back to my medical center, I want my providers to be able to access all that information immediately. So that integration is extremely important. I think the systems are moving in the direction that that will be achieved. We're not there yet, but I think we have the capacity within the current system to get there.
Good, thank you.
Good morning.
Morning.
I believe the ability to successfully implement this record in a level 1 facility will be very informative and telling. And I think until we've reached this point, we certainly support the Secretary and the Undersecretary of Health's vision for a new electronic health record.
Great, thank you.
Thank you. The system as it exists now is currently not meeting our needs. Having said that, there have been marked improvements in specific areas. One area for our facility is the ability for our pharmacy technicians to be able to refill prescriptions in MMR, which takes some of that responsibility off of our pharmacists. In addition to that, in lab, they've been able to identify a number of efficiencies as well. So manifests are better, as is the chain of custody. The lab add-on process is much more efficient. It's easier to see who placed a point of care test, and tests that are sent out are available a lot sooner. So while we're not where we need to be, we believe that a VA central office has made the right decision to commit to getting this right at the sites where the system currently exists.
Good, thank you.
Thanks for that question. I think to be fair to the majority of my staff, they would say that the current system is not yet meeting their needs. And they would say there needs to be major changes, not just in terms of incremental gains, but really human-centered design to make this an efficient and usable system for the future of the VA.
And do you think that that will be possible with this system, that we can get there?
I hope so. I think we need to see a change in the slope of improvements in order to think that that would be the case.
Yeah. Thank you very much for your responses. And a couple of you did talk about compatibility just with outside providers. And I represent Virginia's 2nd District, so Hampton Roads, one of the largest veteran populations, and active duty military. I'm also a primary care provider, nurse practitioner. So for me, the frustration with dealing with the VA, there was no compatibility. We pretty much wrote you off if you were a VA patient and our primary care patient. We relied on your word of mouth. Tell us what happened to the VA. What meds are you on over there? So that's wrong. And I can only imagine the errors that stemmed from those conversations. So also being a provider who has sat through 2 different electronic charting implementations at nursing home facilities, I remember the company coming and just sitting with us and really one-on-one, what is right, what is wrong about this EHR. So what is, I think Mr. Kelcher, you talked about the process with the staff for configuration changes. What does that look like? Does Oracle sit with the staff? Is there a form they fill out? Do they have written documentation that they write on? What does that process look like?
Sure. Both of those happen. We have Cerner staff at our medical center on a weekly basis. So our staff do have the opportunity to sit elbow to elbow with them and walk through some things, explore their understanding of how the system works and could it be done differently. But the formal request for a change, it's through an electronic ticketing system where they can request a configuration change.
I have other questions, but I'm out of time, so I'll yield back. Thank you.